Now, the South African Medical Association has expressed concern over the increased pressure on healthcare facilities during this festive season. The organization says increased alcohol consumption during this time of the year often leads to a surge in emergency admissions at hospitals and clinics, causing additional strain on healthcare workers who are already overworked. For more on this, we are joined by the Vice Chairperson of the South African Medical Association. That's Dr. Zanele Bikitsha. Dr. Bikitsha, thank you so much for your time. Now, during mid-month of December, we heard already from provinces like the Western Cape saying that they dealt with over 6,000 trauma cases. Could this perhaps be an indication of what's happening in other provinces?
Definitely. We do have challenges during our festive season. If you ask any person who works in a trauma based discipline, they will alert you that your December, probably then followed by your Easter, is one of the most difficult times. And that's because as South Africans, during that time of trauma, we tend to overindulge in alcohol because it's all about being together and celebrating, which we've taken to mean as drinking. And that unfortunately results in mass casualties caused by drinking and driving on the road. It ends up with casualties caused by fights that are induced by alcohol also. And that happens a lot during those two festive times. And you now are at a point in time when your hospitals are at their lowest capacity. Because remember, Gucci, that's when you're basically running on a skeleton staff. And yet we must manage with all of that. And when you've got your trauma, it might not only need your casualty officer. It's not necessarily just about stitching a person up and they go. There will be other things, such as taking them to theatre because they've caused internal injury, or fixing bones because they've broken their femur or their pelvis. So it makes it very, very, let's say, cumbersome during the festive season when you've got so much trauma that is surrounding us. And also, alcohol then spreads to other spheres, such as mothers who are expecting, especially younger mothers, also indulging as well.
You speak about hospitals working with a skeleton staff. Are you able to paint us a picture of what hospitals have responded, or rather reported during this time, if their trauma units are a pool of blood?
I'm not sure if you currently know, but as summer, after the incident of the doctors not being employed and the unfilled vacant posts, we're currently engaging. We've written to the minister, we've written to Treasury, and also the provincial HODs, requesting that we have a meeting, that will come together to address this problem. Because currently, in our initial sittings, when we were just dealing with the provincial issues, it became very clear that it is not enough. The money that is allocated to departments does not even cover what their baseline needs for funding are. So it's decided, no, look, let's be part of the solution and take it forward. Another indicator that we do have that things are not going well, if you look at the waiting times in hospitals for your elective surgeries, those elective surgeries, some of their slates are going into the middle of next year. And that is increasing as time is going. I know previously we were talking about the exit of a specialist. So that in itself is showing you the health system is not coping. And you're now going to be taking the few staff that are on the ground and trying to cover emergencies.
Has there ever been, will from authorities to deal with these resources, particularly at a time like the festive season? Have we ever seen these issues being actively addressed and hospitals being, capacitated to deal with the issues that arise?
Yeah, that's the sad thing, Kuti. During December, you're not going to see like in other places where they prepare for it. They maybe put extra staff on the ground. Unfortunately, within the Department of Health, there is no such budget like that. We're not given extra hands, even just recruiting local talent to say for December, please come and step in, pick up a shift or two. That is currently not happening. When you do inquire, it's mainly ascribed to budgetary issues. But at the end of the day, when you've got deaths that could be prevented, had you had the necessary hands on deck and skills, you don't know what to say anymore as a doctor, because you'll find like a district hospital. Within the district hospital, you've probably got one or two people in casualty during the night, and also one doctor covering maternity, one covering theatre. Now, if that other doctor's occupied, no one can look at what's happening.
It looks like
With the minister and treasury, we will be able then to actually get to a figure that will actually staff hospitals properly.
has there ever been a strategy, Dr. Bikitsha, in terms of working from the Department of Health, working with other institutions like the police to help each other cope during this time? Because even police stations will tell you that there is no van to go and attend to a situation where there's been a mass shooting at a tavern during this time. But do you think there's ever been a strategy to work on this particular issue?
Look, yes, there are your what you call your forensic medicine, parts. So your forensic medicines, most of the public would know it as Tutuzela centers, where we take, your rape victims, your assault victims. We take your criminal cases there if they're needing something to be done at a hospital setting. So we do sort of have a relationship, but that relationship also, it's only as good as what we can offer. At one stage, we used to actually have doctors going out when you would have AMA roadblocks, so that we could do the bloods for the roadblock, and we wouldn't have bloods expiring, because you've only got a certain amount of time for those bloods to get to the lab for them to be considered valuable for criminal prosecution. We unfortunately now are overextended and can't even offer that kind of a service anymore, but they do bring them. So in the forensic side, there is, some sort of collaboration. But I must say, within South Africa, there's only about 5 or 6 Tutuzela centers anyway. So if you look at the broader picture of things, it's a drop in the bucket, but also it is limited to what we can offer as the doctors on the ground, because unfortunately our priorities are saving lives.
Dr. Zanele Bikitsha there, thank you very much for your time. She is the chairperson of the South African Medical Association.